What got you into the social media world?
Ran into a dermatology friend of mine and had mentioned, there's this dermatologist and she's on Instagram and she educates and you would totally be good at that. And I just kind of said, no, I don't think that's really for me. I had a private account, was not interested at all in making it public. As I was scrolling one day in 2018, I saw a celebrity and she was talking about how she advocated giving goat's milk to her newborn infant. And of course, that's not what you do. There's
Yeah.
a lot that's really wrong with that. And then I just thought, well, if we're not educating, if the physicians who have the experience or the nurses or the PAs or, all of us in healthcare who know better are not on these platforms where our patients are, then all they're listening to are these celebrities who are touting not evidence-based medicine and just whatever they feel like and giving out a lot of misinformation.
Welcome to another episode of the Save Yourself podcast. Today, I am so excited to be talking to Dr. Rupa Wong. We're going to be talking about all things eye health. We're going to be talking about motherhood, about being a practice owner and leader in her space, and the amazing conference and app that she is building, or they are all building together. Thank you so much for being here, Rupa.
Thanks so much for having me, Amy. I'm really excited to dive deep into all of the topics you mentioned.
Okay, before I get into your official bio, can you tell us a little bit more about you?
Absolutely. So I am a board certified ophthalmologist, fellowship trained in pediatric ophthalmology and adult strabismus. And I've been practicing for 18 years, which is crazy to think about getting on that 2 decade mark.
Yeah.
And 17 of those years has been in Honolulu, Hawaii. And I've experienced both. I was fellowship trained at Boston Children's Hospital, which I still think is the number one pediatric hospital in the country. And I stayed on there as an attending for a year. And then my husband wanted to move out to Hawaii. So I've done both academics as well as now I'm in private practice where I practice with my husband. And we have three lovely kids that we are raising out here in Hawaii. So a lot of what I like to educate about to my own patients as well as online has to do with topics that I feel passionately about as a mom and that I was researching as well. I'm sure as that personal part really gets into the way that you are both a physician and a mother. And so that's really influenced a lot of what I do.
And I want to ask you so many questions, but I'm going to start with your official bio in a minute. Before that, though, I wanted you to tell us what got you into the social media world? Because you're a busy mom, busy practice owner, you run a conference, you do all these things.
So it's really interesting because I still remember it was 2018. That's when I started on social media. And I ran into a dermatology friend of mine and had mentioned now a friend of mine that, there's this dermatologist and she's on Instagram and she educates and you would totally be good at that. And I just kind of said, no, I don't think that's really for me. I had a private account, was not interested at all in making it public or doing any kind of educating online. And as I was scrolling one day in 2018, I saw a celebrity and she was talking about how she advocated giving goat's milk to her newborn infant. And of course, that's not what you do. There's
Yeah.
a lot that's really wrong with that. And then I just thought, well, if we're not educating, if the physicians who have the experience or the nurses or the PAs or, all of us in healthcare who know better are not on these platforms where our patients are, then all they're listening to are these celebrities who are touting not evidence-based medicine and just whatever they feel like and giving out a lot of misinformation. This is back 2018, before the pandemic, before a lot of the other things that were going on. And I just thought, okay, we need to be on here because yes, I at that time I'm 49 now, so I was 42 or something. I felt really old, but I think us older generation, we have to get on there because we have the experience. We have decades of experience actually doing what we need to for our patients. And we're not just med students, we're not just residents or pre-meds, and we have to bring that experience to the table. So it was seeing that post just really triggered, all right, I can't sit and complain about it if I'm not out here on those platforms. And so I made my profile public and started from there.
Starts from there. That is so amazing. And I was on a podcast recently, and the host said something so great. She was like, it's great to hear from celebrities and bloggers and people who are experimenting with health, but that's like a personal journey. That's not necessarily going to be something that you want to follow yourself. Like, it's like a friend telling you that she tried a new food and it worked for her. They're like, we need the experts, the doctors, the people who are the top of their field in that realm, especially in when it comes to health advice, because like going to medical school is like not just like a quick course. It's like an entire journey. And then of course, residency and fellowship for some of us. It is like you really learn a breadth of knowledge that it's very unique, like nobody else really has that. So
Absolutely. And
without further ado, I want to introduce you officially, and then we'll get into it. So Dr. Rupa Wong is a board-certified pediatric ophthalmologist, adult strabismus surgeon, and managing partner of Honolulu Eye Clinic. She's an Ivy League trained physician. She has been in private practice for over 17 years. Dr. Wong is also a passionate educator, entrepreneur, a content creator. She co-founded Lear, is it Lear at Pinnacle?
learn at Pinnacle.
Learn at Pinnacle. There's a typo. And
Oh,
host the podcast In Focus, advocating for children's eye health. I'm going to ask you about that, screen time balance, and women in medicine on her platforms. With a strong online following, she empowers parents and professionals alike with evidence-based, relatable information that bridges science, health, and everyday life. So first off, I want to ask you about this crazy thing that you posted. What's not crazy, but it's so interesting that your children don't have glasses yet because of something that you're doing. And I think this is something that a lot of people don't know about.
so this has been, I was really surprised because I've been educating about this topic. You know how it is. For
Yes.
years, for
Yeah.
3, 4 years, I've been using it with my patients since 2014, 2013. So over a decade. But finally, this post picked up steam and people are now like really understanding. So basically what this is it's called myopia management. So myopia is nearsightedness. And that is when you need glasses to see far away, but things up close or near are clear. And it is something that tends to be genetic. There's a lot of different lifestyle risk factors that we can talk about why we're seeing such an increase in nearsightedness in our kids. And I was not nearsighted growing up. I'm not nearsighted at all. I'm just 49 and need reading glasses. But my husband's family is very nearsighted. And when you are extremely nearsighted, the eyeball is actually longer than an average eye that's not nearsighted. And that's what puts the vision at risk. It's not just simply wearing glasses. It increases your chance of retinal detachments and cataracts and glaucoma and myopic maculopathy. So there's all these ocular health consequences with being even moderately to highly myopic. So that's the medical term for nearsighted. And there are strategies to slow that worsening. Do you wear glasses, Amy? I can't remember.
I no, but I have just gotten them for nearsightedness
For,
because I need them for driving and
oh, okay.
like see, which is weird because I have the opposite.
Yeah.
I never got reading glasses, or haven't gotten them yet. I don't have trouble reading close. I actually just developed over the last couple of years nearsightedness, and I don't know if that's just a basic because it's like eye fatigue. Well, you can tell us why, but it really just happened recently, so I wear them when I drive. Yeah.
Oh, okay. That's interesting. That's actually really quite uncommon to
Yeah.
develop nearsightedness in your 40s. But for most people, they develop nearsightedness, when they're a kid or a teenager, sometimes even in college because of all the excessive work that they're doing, studying, graduate school. And every year, the courses you go in and the glasses prescription goes up. So that's
Hmm.
where a lot of eye myths had started with glasses are making the vision worse. Though actually that might kind of be true. And that's another topic we can get into. But it's not inevitable that it has to worsen every year. So there's special contact lenses that can be used to slow that progression. And then specially mixed drops, which is called low dose atropine. It's an atropine drop that gets mixed in a compounding pharmacy to dilute it. And this dilute version of the drop, you give it every day at nighttime, can slow the worsening of nearsightedness. Now, for my 3 kids, I just knew that they had a strong couple risk factors, family history, East Asian ethnicity is also a risk factor. And so I really wanted to make sure they didn't have retinal detachments like a lot of my in-laws do, because they've
Mhm.
got really long eyes. So I had looked at the data and saw that there were some studies coming out about low dose atropine and using it to prevent nearsightedness. Now, I even started this earlier than some of those studies came out, but they're my children. And I knew that the risk profile was really low of using this eye drop. And so I did. And so far, not good. All three
Not good.
kids are not nearsighted at all, unlike my husband. So that's great. And what we've really been able to do is stabilize the lengthening of their eye. And so that's been truly huge. But yes, that it got shared and posted in a lot of groups, and people were wishing that they knew about it when they were younger. And I think it just really breaks the barriers down for the education that sometimes does not make its way to the patients, depending, unfortunately, on the bias of the physician or the optometrist that's giving out that information. So I'm
So,
just happy to get it out there.
is this something that parents should inquire about, or is this something that, like, how should people approach this?
So I think if they have a risk factor, so if the parents are really nearsighted, if there's a family history of retinal detachments, when you go in to see the ophthalmologist or the optometrist, they're going to do a series of tests for your child. They'll check the vision. They will check to see if they're already nearsighted or not. Now, let's just assume they have perfect 20/20 vision. They're not nearsighted at all. Then I think the first step really is just modifying those lifestyle risk factors. They have shown in so many studies that 2 hours a day of outdoor time is helpful at preventing that worsening of nearsightedness. That's free. That's absolutely free.
Yeah.
And though it might not be easy to always achieve, I mean, I'm in Hawaii, so I can get the kids outside. They get outdoor time all the time. But I know it can be really difficult in the northern hemispheres where there's winters to get that outdoor time. But it's been shown in studies all across the world and in different ethnicities. And then also near work. And that's not only screen time. Screen time is a component of near work. Near work is like reading and writing and coloring or even sewing. But what are our kids on mostly? They're not,
Yeah.
most of our kids are not reading for 10 hours a day. They are on their phones, right? So starting to limit that kind of recreational use as much as possible within the realm of just letting them be a kid as well, but just being intentional. I think that's the most important part of that.
How does like screen time basically affect their eyes in like in a negative way?
So all of this stuff, screen time, it's right now they have not really seen there's no head-to-head study of screen time versus reading,
Okay.
right? It does screen time affect the eyes worse
Hmm.
than reading because it's got this three-dimensionality and the
Hmm.
background. There's no science for that, but there is science that has shown the increase in nearsightedness if you are spending 4 hours, if a child's spending 4 hours a day on a screen, it greatly increases their risk of nearsightedness up to 97%. And then every hour on top of that's an extra 20%. So, but that is that because they're not outside as much as when they are on a screen. So those parts are a little bit harder to tease out. So it's not per se that the screen itself, it's not certainly not the blue light, because there's a lot of misinformation during COVID and the blue light blocking glasses. It is not the blue light from the screen that's causing the nearsightedness. We get 1,000 times more blue light from the sun than we do from any of our electronic devices. So I always want people to
That's a
remember that
really good
aspect of
myth
it.
bust. So what you're saying is that blue light blocking glasses and then being on a device for multiple hours a day is not going to help your eyes or shield them or protect them in many ways. Is that right?
It won't protect them against nearsightedness
Got it.
development. Okay. So for some people, they really like it for migraines. There's been some studies that certain kinds of wavelength blocking for a larger blue light blocking can help with ocular migraines. About 30% of the patients in one study had a decrease in ocular migraines or even visual snow. So I don't want to say it doesn't help. You are always talking as well about circadian rhythms. I do think if you've got kids, my oldest is similar to your oldest.
Yeah.
He's 16. He's up till 10 p.m. doing his homework on his laptop. So, at least just using the dark mode filter just to help it with
Hmm.
sleep. I think that's really important, but it is not going to help with nearsightedness. And I think that people were concerned about that and thought that that might be the case. it really isn't. So I definitely want to disabuse that.
Okay, so nearsightedness, so just to clarify to people who are watching or listening, is when you can't see far, like things on a
Hmm.
board or
Yep.
while driving. Why has that skyrocketed and how much?
It has skyrocketed. And by 2050, it's estimated that half the world's population is going to be nearsighted, which is crazy. So I don't know if you've noticed, I don't know if you have an iPhone,
Yeah,
but
I
now
do.
there are these settings on your iPhone and even on your iPad for your child that they will say, oh, you're too close. And to push, there's a little setting you can, I think it's under the health features that you can enable because it's how close you are to your device, the intensity with which you're using it. So if you're doing it without a break, uninterrupted, that's also been shown to be a little bit worse than just the total amount of time. In addition, on the iPhone 2, they also monitor that outdoor time. So
Mm,
that's because they're looking at the research. So I thought that was really interesting that Apple Health had those two features to
yeah,
minimize the nearsightedness because they
yeah,
know that these devices are, it's really these lifestyle risk factors. Our kids are spending more time indoors, more time doing near work, less time in the protective outdoor space. You don't have to do anything physical outdoors. It's just being outside those 2 hours a day. So it's really just all of these risk factors that's caused this tremendous increase in, I think it was 2000 or no, in 1980, the average age of nearsightedness onset was 11 years old. Now it's 8 years old. So
wow.
in 20 years later. So there's a big difference. And we have to look at the environment. It's not the only cause. There's a lot of family history and genetic causes. But why is it so much worse? I mean, there's a lot more studying, whether on screens or just on paper, right? Everybody's going to tutoring.
Yeah.
You look at the Asian countries, which have Singapore, I think it has like 80 to 90% of high school seniors are nearsighted because they are literally going from school to tutoring because there's so much academic rigor,
Mm,
right? So, and if you compare, even they did a study in the Philippines, urban versus rural, urban environments with less outdoor time, with kids that are spending more time indoors, worse nearsightedness compared to the exact same ethnicity population out in the rural areas. So we have to look at the environment, which is really causing a lot of this.
well, that's so funny you say that because I know that this is mostly we're talking about kids, but when I just told you I developed nearsightedness, it
Yes.
was literally what happened is after COVID, I decided to go full on social media. And
Yep.
so I would be in clinic and the clinic switched over to medical, online everything. And then I was constantly on my phone in between or after or whatever. And I honestly believe that because I was like went on this journey as you did, like just dove into it, I think I probably put myself into like that near too much of that
I,
near work. And I never had done that before, even through all those years of training in medical school.
I think that's exactly probably what happened. I mean, it's hard to say, but the way that the
Yeah.
focusing muscles are working, that's why we think that it causes, nearsightedness and near work. I found an article in the Journal of Pediatrics from 1930, and it talked
Wow.
about how to slow nearsightedness down. And literally it said, get your child outdoors. And then it talked about low dose atropine also. It was
Wow.
amazing to find this reference from 100 years ago. So, I mean, these are things that they've been thinking about and have been studying for 100 years.
So what is the consequence though of like nearsightedness or just eye strain in general?
So, eye strain in general, of course, it's uncomfortable. So, some people
Hmm.
have, they call it now computer vision
Hmm.
fatigue syndrome or digital fatigue syndrome. And that
Hmm.
really comes from your eyes tend to get dry because when we're on devices, when we're on screens, our blink rate is much more decreased than when you and I are
Mm.
talking to each other in person. So
Interesting.
we really need a good blink rate because our tears are responsible for a large portion of the clarity of our vision. And you need a good complete blink closure to pump out a good tear so that your vision is clear. So a lot of what just that dryness, eye fatigue, scratchy feeling that people are feeling when they're on devices or Zooms or screens is because you're just not blinking as much. So taking those breaks, that's where the 20-20-20 rule came out. Every
Hmm.
20 minutes, you take a 20-second break where you look at something 20 feet away. And while doing that, blink a couple times. And I remember I sent all this information to my kids' teachers during the pandemic. And I was watching them when they were all doing distance learning. And I saw my daughter going like, what are you doing? She's like, oh, my teacher says we have to do this every 20 minutes. She sets a timer. And I
That's so
loved it.
cute.
I loved it. But that is what a lot of people are feeling. It's just that dryness. So taking breaks, using some re-wetting drops like artificial tears. And usually that's going to help with that. But then more seriously, if you are in that moderate to high risk category and the length of your eye is starting to get into that worrisome area, that then we worry about those retinal breaks and tears. And think about it like this. It's like a balloon. The inner lining of your eye, your retina, which is the camera film, it's very sensitive. It sends all the photoreceptor signals to your occipital region, to the vision centers back there. Think of it like a balloon that you blow up. And then if the eyeball gets longer, then you blow up a little bit more. You still have the same amount of balloon material, so that retina
Mm.
is more thin. It's stretched more thin. It's more liable to break and for fluid to get underneath and to cause a detachment. And so those are all the consequences of axial myopia, axial being how long the eye is, are from the retina or the cataracts or the glaucoma. It's just that stretching of the eye, the elongation of the eye.
So when you are, say, someone who wears glasses for nearsightedness, and you don't wear the glasses, is it damaging your eye or putting more stress on it, or what? Or is it just that you can't see as well?
Typically, if you're, so again, everything gets classified into if you're a child or an adult.
Okay.
So if you are an adult and you don't wear your, like for you don't wear
Yeah.
your nearsighted glasses, it's not going to damage your eyes. It's not going to make your eyes better. A lot of people will do this kind of vision therapy and they say, oh, my eyes got better.
Yeah.
It's just, you've kind of more retrained the brain to kind of accept that blur.
Mm.
It's not that they've changed in some musculature way. It's just brain adaptation, which is good too. I don't disregard that as being important and meaningful. But for a child, it again really depends, because if they need those glasses to see well, and if their myopia or their nearsightedness is very high, they might actually develop amblyopia or a lazy eye if they don't wear their glasses, because their brain is not getting the sensory input that it needs. And then it can start to shut the eye off. So that is what we worry about
Wow.
with
Okay.
the vision centers. Now, if someone's just like, even a child is like very mildly nearsighted, I will tell them to take their glasses off for reading up close, because I don't want
Mm.
them over focusing through the glasses to see up close. Like you probably notice, like if you put your nearsighted glasses on, try to read up close, it's hard.
It's the worst because
Yes.
now, I mean, I know you're never supposed to look at your phone anyways, but now I really just can't. I can't see anything on my phone
Yes.
because I have my glasses on. So it's like, even if a text message comes through, I have to like wait till I'm stopped or parked
Yep.
to even take the glasses up because I can't really read. When I have my glasses, which is such a new experience for me because I really didn't have that. So I love this advice or this insight that you're giving. Okay, switching gears because I know there's so many people who love lash extensions. And
Yes.
even now there's like home kits, like you
Yeah.
won't believe it, but my daughter, who's almost 16 now, she buys these things where you put it under your, so like
Yeah.
it's
Yeah.
now happening younger and younger. And tell us about the good and the bad and the ugly.
So I've done all of those
Yeah.
because I love a good lash. I
Yeah.
100%. But ultimately, especially the ones that use the glue, and I've done the under ones, I've done the
Yeah.
lash extensions. The problem is the glue. And the
Yeah.
problem is the cleaning. So I don't know, when
Mm.
she does the lashes that she attaches underneath, is she removing them every single night and really
Yeah.
cleaning her lashes? Because if not, that's the perfect milieu for a lash mite infestation. Like many of us have lash mites, but again, it's that, I think of it like you're an expert in the gut microbiome. Think of it like the gut microbiome. We all have lash mites. It only becomes a problem when they overpopulate, and they like to overpopulate when there's a lot of like mucus and moist and warm environment and like extra makeup to eat up and digest, right? And that then causes further problems. So it's really the issue with the lash extensions that we see is just people are not cleaning them well. So there's a lot of debris and particulate matter, collarettes that we call them, in between the lashes. They get blocked up. And then that actually is going to make your natural lash growth decrease. And then people get kind of addicted to the lashes. Well, because when they pull them off, then their lashes don't look so great. First, because of the weight of the lashes, which does actually cause the lashes to drop out, despite what your lash artist will say. And I know I might get some hate on that, but I did use lash extension, and
Yeah.
just accept it. Like, I accepted it. It's fine. I'm going to lose a few lashes, but you can't argue with the fact that that is attached to your lash and it's weighing it down, and it does. Now, there's certain people that have maybe shorter and like just really strong, thicker lashes. Mine are not like that. So I knew that I was going to lose a few lashes every time I got extensions. But you really, if someone's just like die hard, they have to use their extensions, then just make sure to clean them every single night with the special lash cleansing formulation that the lash artist is going to give to you. That's the most important thing. So that's why I like at least better the ones that are a little more temporary, that you can clean every single night, take them off, and then just do a good scrub and then put them back on.
So for people who do get, and I love a good lash extension too, or even false lashes, are you supposed to take a break? Or is
So
it like, yeah,
for extensions, you do probably really want to take a break because, like I said, the
how
weight
often?
of it. I mean, again, ophthalmologists don't recommend extensions at all. So we would say don't use
Yeah,
them at all. But if you're committed to them, I mean, you just really have to check to see how much, your lash artist can take a picture. I mean,
yeah.
the macro photos option on your iPhone is really pretty good. See if there's a lot of buildup, if there's a lot of like swelling at the base of the lashes, if there's a lot of redness there, then those are all signs if you're getting a lot of discharge. If you wake up in the morning and you can barely pry your eyes open, those are signs that you're starting to get some inflammation or lash mite infestation. You need to take a break. You probably need to get treatment. There's actually an eye drop now that can work and eradicate lash mites. You have to use it for 6 weeks. And then, if you really need to, you can restart. I do prefer then the strip ones because at least they're on the eyelid and then you're taking them off at the end of the day. So and then you're cleaning everything off.
Oh my God. I remember when I first wore strip lashes for the first time, and that was like not until I think maybe wedding time or something. And I remember feeling like I cannot believe that people wear these because it felt so heavy. And now
Yeah.
I think back and I'm like, God, this is like, I do that all the time or for events or whatever. It's really is very heavy for your eye. But like you said, when you take it off at the end of the day, those are nice because you can just wash off
Hmm.
everything, wash off your
Yeah.
makeup and your lashes all at the same time. So that's nice. Now, what about people who get really, is there this thing, is that this a real thing when you get your makeup done?
Hmm.
Is that what's irritating to the eyes when you're getting your makeup done? For example, a lot of people I know, including myself, tear a lot when we're getting our
Hmm.
makeup, even if they're not doing our eye makeup. Is there a reason? Is that something that a lot of people feel?
I think a lot of people do. I think it just, especially if you're saying like when you're getting it applied by a professional makeup artist
Hmm.
versus when
Yeah.
you do your own
Yeah.
makeup,
Yeah.
I think part of that is you're not blinking.
Mm.
You're actually doing your eyes are
Hmm.
closed for the
Hmm.
most part, but the rest of them, you're really looking, your eyes are wide open, they dry out. So when
Mm.
you are dry, which seems crazy, your body makes this reflex tear, but it's just not as lubricating as your natural tear is. So you start to tear from that. Sometimes you might be allergic to different products that they're using. If they're using, especially for glam events, they're using glitter eyeshadow that tends to get in the eyes. There's a lot of loose particulate matter, especially with glitter. I mean, I will do a glitter eye every now and then, but you just know that stuff can get into your eye and that can be irritating for people as well. So there's all these sorts of different things that can cause issues. And then the lash glue itself, if you're doing strip lashes or individual lashes, almost all of it is cyanoacrylate, which off gases formaldehyde. And so I realized I was allergic to that lash glue when I started doing lash extensions, which is why I had to stop. My eyes would be red for 2 days after I did
Yeah.
extensions. So all of that can be a reason to have sensitive eyes or tearing eyes when you're getting your makeup put in. So I would just, if you're getting your makeup and you find that happens, put a drop of artificial tears in before the start of the makeup session. Take breaks where
Okay.
just you're not on your phone taking a break, where you're just going getting a snack, like just looking at things in the distance. Just give your eyes a chance to reset because it still is a lot of up close activity. And then just obviously making sure that you're not allergic to any of the products, that they're cleaned, the applicators and the brushes and all of that are cleaned properly. I will bring my own things. I have such an extensive collection. I love makeup. So I
Oh,
bring my
yeah.
own stuff to when I need to get my makeup done, and they can apply that. But I bring everything myself.
I love it. Okay, switching gears, you are a mom and a practice owner, and you kind of have this summit and an app. Can you tell us a little bit about Pinnacle and the app that you've created?
The Pinnacle is a multi-specialty women's now, well, it started as a conference. It's now a multi-specialty educational platform. You, of course, spoke at Pinnacle. Was it 2 years ago? I can't even
I think
remember now. My
so. I mean, I've
time
heard,
frame
by the way,
is,
I've heard such great things about this recent
oh, it's so
conference. A few
good.
of my friends from here that I connected with recently were like singing its praises. So great job.
Oh, thank you, Amy. That's so nice to hear. But yes, it's now in its sixth year. It started as an annual conference. We, of course, went virtual during the pandemic, had a virtual membership. But the exciting thing that happened last year is we got our joint accreditation. So we are now a continuing medical education company. So we can accredit other people's conferences, we can accredit their courses, and then we have an app now where we have podcasts and YouTubes and videos, and it's all for free for people to sign up for. And then they can actually get free CME. And we offer 10 different types of CME or continuing education credits. So not just the category one AMA
Mhm.
CME for that physicians need, but for nurses, trainers, psychologists, optometrists, everything. So we've got all of the different types of credit, and it's information that most people are interested in. So even if me as an ophthalmologist, sometimes I just want to learn about what you talked about, right?
Yeah.
I want to learn about these other things. I want to learn about metabolic syndrome or GLP-1 agonists, or just
Yeah.
because it's interesting
It's
and not
part of our
necessarily,
life. Yeah.
it's part of our life. And sometimes I get really bored just going to all the ophthalmology conferences and listening to the same talks over and over. So I find it really, there's a great talk about sleep by a sleep psychologist. These are, so it's just, I think, kind of almost life,
I love it.
what we are all interested in life. But then if you're really specifically interested in cataract surgery, those are on there as well. And you can get free CME for it. So that's
That's actually
it's a Learn at
great.
Pinnacle app. Yeah.
Yeah. So how do you find out more about that again?
That is on, you can just download wherever you get your apps if you have an iPhone or Android, and it's called Learn at Pinnacle. Just download
Perfect.
it, set up your profile, and then get going with getting your free CME.
Tell us more about the conference. Like, who can attend? How can people attend? What is that?
So, same. The conference is for every woman in healthcare. And we were very specific about that because I feel like we are facing so many of the same challenges and
Hmm.
obstacles and struggles as women in medicine. And Natalie Crawford and Pamela Mehta, who are my co-founders for Pinnacle, felt the same. So this is a conference that is open to any woman in medicine. We have psychologists, we have nurses, we have PAs that are there. I mean, the majority of the people are physicians, but it's such a collaborative place that it's you just the idea they're always bouncing off of one another. And I think that's what's so amazing. My sister-in-law, who is a concierge endocrinologist here in Hawaii, came this past year. And honestly, I wasn't sure that what she would find. She's a little bit older. She's 7 years older than I am. So in her mid to late 50s now. And I thought, okay, is she going to find anything useful? And she really was, I think that's what's so amazing is the peer-to-peer mentoring as well, like
Yes.
that you learn from. She connected with Arthi Thungodu, who's probably 15, 20 years younger than her, but is a concierge endocrinologist in Texas. And they just were trading, just life advice and practice advice. And so all of that, I think, is just really the beauty of Pinnacle, what comes out of it. And just that the connection, that the community is just truly been amazing to help cultivate, and is what makes that group so special. So
I
it's
mean,
every May.
when I came, that exact thing happened to me. Like I connected with people that I never thought I would connect with.
Yeah,
Hafiza Khan, that I
I
still
love her.
remember this. I had met her online, like, when we did like that South Asian kind of collab.
Right.
But I had never met her in person. And she just taught me so much. Like,
Oh, she's the
she's just
best.
so like, I had just started on social media, like, very much more than I used to. I had been like dipping my toes in. And she just knew so many tips and tricks and just like, and then we talked about just medicine in general and how, like, why hormone therapy was bad for the heart, like we were talking about testosterone and all these people who were doing pellets. And It was just such a eye-opening and bonding experience for me. And that was just one example of the people I connected with. So I definitely enjoyed it a lot. Are you guys switching it up, or is it like the same format as it's always been?
It's pretty much the same format as when you were there 2 years ago, where we have it's a Friday night
Hmm.
reception and cocktail hour. And then Saturday is we have a run now. I don't think we had the run when
No,
you were there. So we
that's
have a
fun.
run for research, which is amazing because you list which charity, medical charity, research charity you want money donated to. And Sermo donates the money on your behalf.
Cool.
And Brooks gives you a free pair of shoes to do it in, which is awesome. So we have
Awesome.
a run that we do in the morning, then the conference. And then we've also now added roundtable sessions because people told us they wanted to have more time to really connect with other people. So we had
Hmm.
different topics: business of medicine, work life balance, entrepreneurship. And we had tables with leaders at each table. And that went so amazingly well. And then Sunday is our workshop day. So we try to keep the Saturday talks just tight and interesting and allow a lot of time for questions. But we've just kind of every year we say we're not going to add something and we add something.
That's
So we added the roundtables
amazing.
this year, added the run last year. So you got to come back for
I will. That
2026.
sounds amazing. Um, okay, and then I guess my final kind of topic that I really wanted to touch on is like you have been a practice owner and kind of running a business really for the last, what, 17, 18
Yeah.
years. And so, what is it that you wish the younger Dr. Wong knew? Like now that you've done this for so many years, was there something that you look back on and you go, wow, I wish I knew this back
I think just the importance of your team. I think that's
then?
probably the biggest thing to really understand. I came from a very academic environment, right? When you're an employee, you're just handed whatever medical assistant or ophthalmic tech and you just work with them. When you're building your own practice, you have the chance to truly create the culture. And I don't know if I really understood that those first few years of practice. I just thought, why can't they do this? It's just I'm paying for them to do this. Like, just do it already. And I think it took me a few years into practice to truly understand what leadership is. And so I just on the back here of my bookshelf, it's all leadership books. It's
Love it.
all the leadership books like Drive, Daniel Pink's Drive, all of those books that are just really important about how to create that company culture because the staff is honestly the most important part. I'm a well-trained physician. My husband is. We have two optometrists. We have a great optical. But at the end of the day, it's the staff that our patients remember, and I think that learning how to invest in them, how to listen to them, even if you don't like what they're saying, I think those are all things that we don't obviously learn in medical school. It's taught to be so hierarchical in medical school, right? You're
Yes.
a intern. You just do what you say. You're a resident. You do what the attending tells you, right? You just suck it up and you do it. And so sometimes you come out and you have that expectation of others, like just do it. Like that's just what you
Yeah.
should do. And it's not the way you run a business. It's not the way you run a practice. And so I'm very lucky. I mean, we have people that have been with us for 10, 12 years now. My other sister-in-law who sees me as a patient was just saying, oh, I've been to so many other doctors. And I was talking to a couple other people who see you and they're all doctors. And they just say your clinic has the best staff of any practice on island. And that is so wonderful to hear. For me, that's even better than hearing that they liked me personally, just
Yeah.
knowing that they had a really phenomenal experience from top to bottom. And the interesting thing is I have a lot of virtual assistants in my staff. And my sister-in-law mentioned one of my virtual texts. She's like, oh yeah, she's so great. She texts me right away. I said, she's in Vegas. She's not even here.
Wow.
So you can do that. You can create that company culture in person and even with remote work too, with your virtual staff. So I think that was probably the one of the biggest things to learn, and just always being ready to just think a little bit outside the box. When we brought in the virtual scribes and I brought in, and my whole rest of my office manager thought I was crazy. My husband thought I was crazy. He's like, how can you have a virtual scribe? Or this is going to work. I don't think it's going to work. Now we have three virtual techs, a virtual receptionist, a virtual tech. So I mean, it does work. I think you have to be willing to think outside the box a little bit when you're a practice owner, and it's not going to be something you've learned. You got to keep learning, but in a different way. Business, management, leadership. Those are the books. once I was, 5, 10 years out, I knew the clinical stuff. I knew how to
Yeah.
operate. I knew the surgical things. I'm still brushing up on all of that every
Yeah.
time I go to a conference, but you gotta read all this behind me.
What's your favorite? If you had to go to one, maybe one, two, or three books that you would say anyone who's like trying to run a business should read.
I actually still love the 7 habits of highly effective
I like
people.
that one too.
It's just, I feel like there's so much that's applicable to running. I mean, just to people in general.
Yeah.
I think as a mom, it's a great book, and I think yeah, and there's just so many different ways when you're negotiating with people. It doesn't need to be win lose. It can be a win win situation, and I think that that's really important. And it's still my go to, even though it's so old.
I
It's
know.
still my
I
go
love
to.
it. I think it's like required reading for some schools, even, which is
Oh,
amazing. So, how can people find more about you, about your practice, but also about your work that you do outside of the clinic? Where's everything about Dr. Rupa Wong?
so I have a personal website, which is drrupawong.com, which has the two R's side by side. So some people get thrown with that.
Oh, yeah.
I'm on Instagram and TikTok and YouTube, all with the same name, and LinkedIn, Dr. Rupa Wong. I'm on Facebook, but for some reason, Dr. Rupa Wong was taken. So I don't know who has that. It's Rupa Wong MD on Facebook.
That's so
And then,
interesting. Who has
right?
the same?
Who took it? Someone grabbed it before I could. And then all of our information, I have links on my Dr. Rupa Wong website for Pinnacle, but you can go directly to learn@pinnacle.com and grab all the information if you are interested in having your conference CME accredited, or your course CME accredited, or you want your podcast to be for free on our app so that your listeners can get free CME for it. All of those things are available on the learn@pinnacle.com website.
Amazing. Thank you so much for being here. And I think we have so much more to talk about. This is just like a microcosm of all the things we could have talked about. So we'll definitely do a part two. I want to thank you for your time, and thanks for I think it's been a long time coming that we've needed to connect anyway. So this was just like a way to connect that's kind of broadcast to everyone. And you had such great information. I definitely learned a lot. So thank you so much.
Thanks so much for having me, Amy. You got to come out to Hawaii. We'll do it in person one time.
Yes, for sure. All right. That's it. Thank you everyone for listening, and stay tuned for another episode of the Save Yourself podcast.